All right, I think we are good to go. My apologies, but thanks to each and every one of you for your patience once again, and to show my face and let you know I'm a real live human being. So again, assalamu alaikum. Welcome to today's webinar. This is actually CAIR-Chicago's first Facebook Live event. Although we've been in partnership with other organizations, this is our first and very own through our Facebook page on CAIR-Chicago. Just look for it and we'll pop up. So for today, this is a webinar that has been in a continuous stream for several years now. There has always been a focal point of our civil rights work that we want to understand how our community is doing. Either it's something that's very private and personal to something that is widespread throughout the country and the world. Mental health is something that's always been a particular focus of ours, and we're so happy today to bring you this particular issue. So welcome to, hey, checking in, how you're doing, addressing mental health toll on the Muslim community. So this particular event is actually the brainchild of one of our current summer 2020 interns. Monica Winter is a recent graduate from the University of Iowa with a bachelor's in social work. And so this is a part of her practicum to really look into particular social issues that could be part of what she'll take on as a social work practitioner. With that, I want to turn it over to Monica, who will be the moderator for the event. Monica?
Assalamu alaikum, everyone, and a special welcome and thank you to my esteemed panelists. Thank you for joining Council of American Islamic Relations, hey, checking in. How you doing? Webinar addressing mental health tolls in the Muslim community following the most recent events regarding social unrest and a roaring pandemic. My name is Monica Winter. I will be your moderator this afternoon. I am CAIR-Chicago's summer intern and a recent University of Iowa School of Social Work graduate. Go Hawks. The shelter-in-place ordinance introduces restrictions and confinements for communities, leaving many members disconnected and feeling isolated. Further, the Black Lives Matter movement has brought attention to hundreds of years of inequality and inequity. The BLM movement is highly emotional for those who are directly affected by the years of injustice in the United States, and can be a challenge for those who stand in allegiance, emotionally and mentally and physically. Together with the Khalil Center, Musen, and the American Muslim Health Professionals, I challenge the discussion of mental health in response to the Muslim communities we serve. The agenda for today's webinar will be a series of 5 panel discussion questions, followed by a Q&A opportunity for you, the audience, to ask our panelists your queries. Please feel free to enter your questions in the comment box below, and we will respond at the end of the panel discussion. Also, if you wouldn't mind, please indicate if your questions are directed to a certain individual or if they are just general. Without further ado, I will allow for my panelists to introduce themselves. Let us begin with Ms. Hana Khan from Musen.
Salam, thank you, CAIR, so much for having me here today. I am Hana Khan from Musen. I am actually the operations manager there. And for those of you who are not familiar with MUSLIN, it's a nonprofit organization which serves the brothers and sisters with special needs in our community. So we do a lot of work with, advocacy, educating the community. We've implemented programs nationwide to serve these individuals. And our end goal is to make sure that all these individuals with special needs are included as part of our community in every way possible.
Thank you, Hannah. Dr. Jalil Abdul Adil, who is here in representation of the Khalil Center.
Assalamu alaikum and jazakumullah khair for having me. Thank you for having me. I'm an associate professor of clinical psychology at the University of Illinois, Chicago. A major part of my work is providing trainings and consultations to mental health providers and agencies, both here in Chicago and around the country. My current activities are focused on the dissemination and implementation of trauma-informed prevention and intervention. And I work with the National Child Traumatic Stress Network and the Substance Abuse and Mental Health Services Administration. I've had the pleasure of working with the Khalil Center since its inception, particularly in supporting clinician training and program development. And I thank you for inviting me to share this perspective on this topic today.
Thank you, Dr. Jalil. And finally, Dr. Roxana Chowdhury, who is here in representation of the American Muslim Health Professionals.
Thank you so much, Monica and CAIR, for bringing us together for this really important webinar. I am Dr. Roxana Chowdhury. I'm the Director of Mental Health Programming for the American Muslim Health Professionals. I am currently an Assistant Professor of Clinical Psychology at the George Washington University. And, our work at AMP as in terms of mental health is to really utilize our platform of American Muslim Health Professionals to strengthen the well-being and mental health of all Americans. So we work in areas of advocacy, education, and really offering our partnerships in a way to directly serve, in a clinical sense as well, the American population. So we serve all people of all backgrounds, and we are really proud of that, in that we are considering our Muslim community as absolutely part of the broader, nation that we're a part of, and we utilize our background to do that and our expertise.
Awesome. Thank you. Now we will begin our panel discussion. According to a 2018 study done by the American Psychiatric Association, 43% of the Muslim community is affected in some way by a mental health disorder. How has your organization seen this within its community? Has your organization seen an increase of cases related to mental health in the last year? Is it better or worse than previous? To begin the discussion, I invite Dr. Roxana Chowdhury.
Thank you. So this question is really critical to understanding where we are as a country in terms of dealing with COVID-19 as our current crisis, and of course the American Muslim community as particularly dealing with certain issues and concerns around that. What we know is that, Muslims make up a major part of one of the most socioeconomically disadvantaged faith groups in the United States. And due to that, low-income people that are most hit by the pandemic often deal also with mental health concerns and issues and aggravated mental health disorders that might already exist. So we also know about the American Muslim community that many of our community members are frontline healthcare workers, or they lack access to proper healthcare. And due to that, these are sort of confounding socioeconomic and sociological factors that impact our mental health overall. So we know that when you are taking on the stress of the pandemic, along with this financial concerns, along with possibly being a mental health or health frontline worker, health worker, you are really working on this process of coping with really an inundation of stress. And when you deal with that level of stress or already have an existing mental health issue, you're really going to see a rise overall in the amount of mental health related factors that would affect your life overall. So we know that people have seen, there's been an overall increase in depression and anxiety disorders during this time. We've seen that through various surveys that have been conducted for frontline healthcare workers that are Muslim and overall in the United States. So when we look at our community, we do have to contextualize that as being part of the United States in general and what type of issues people are facing. We also know that people who are suffering from trauma-related issues already and having experienced that. Pandemic in itself has brought on an amplification and really, like I said, aggravation of those trauma-related stressors, which impact the way we cope with the trauma that's already existed. So if you are a refugee or an immigrant with trauma in your history, and then you have to cope with the pandemic in terms of various factors that have impacted that, whether it's financial or whether it's the impact of being disconnected and isolated during a lockdown, those aspects of suffering or experiencing trauma in the past where you are really unable to kind of cope with the level of stress you've already had, and then that gets aggravated, that can lead to even an increase in depression, which often is comorbid with trauma. So we see all kinds of manifestations of different aspects of mental health in our American Muslim community. We're also doing a lot of research, AMP and other American Muslim organizations, on the impact on frontline healthcare workers that are Muslim. As we've seen a rise in anxiety and stress-related disorders and issues, we're really trying to ascertain what the long-term impact of that is. So the really important point of this is that as we see a rise in mental health issues, what will be the long-term impact on our mental health, but also how that connects to our health. So we know that American Muslims, being a large portion of the American Muslim community, is Black, is perhaps underserved. We have to understand that the health factors that we will see long-term are really connected directly to the mental health aspect of dealing with the pandemic as well. So and then, I know we'll get into the racial justice piece, but some of that is all something we need to understand as a community and kind of get to a better level of learning a bit about for the future and where we'll be in about 2 to 3 years from now.
Thank you, Dr. Roxana, for your insightful conversation. Dr. Jalil, being the Associate Professor of the Clinical Psychology Department at UIC, you're familiar with varying mental health diagnoses. In your work with the UYTC, your Urban Youth Trauma Center, how have you seen a decrease or increase over the past year?
Thank you, Monica. We have seen an increase in both the recognition of the impact of mental health disorders, and amongst the Muslim community, we have seen an increased need to embrace addressing the mental health issue, which might be distinct, if not necessarily common, to things which have happened in this country and around the world. So to get right to it, we know that Muslims now are being confronted with having to address a lot of the historical, chronic, and discriminatory stressors which have impacted communities here at an indigenous level, as you mentioned, for centuries. On top of that, there's the internal challenges of being able to acknowledge and address mental health from a Western social science perspective, which there's still stigma in the Muslim community regarding going outside of your family, let alone outside of your religious circles, to mainstream institutions that may or may not be as culturally sensitive as they should be when Muslims come. So it's almost a paradoxical situation of having an intensified need with the shrinkage in resources, and the resources which are accessible are mainstream, and so they may not be effective for you. So mental health within the Muslim community, I'm very happy to say we're taking a greater step toward incorporating that into the day-to-day discussions, having services be embedded within the day-to-day routines, the indigenous structures such as masjids and other Muslim organizations, so that our youth, our adults, our elderly, we can all access it. And I'm also happy to say that my partnership with the Khalil Center entails also discussing how we work with a train-the-trainer model, which is to partner with the religious leaders, the ulama, the shuyukh, the classically trained Islamic scholars, to be aware of and make referrals to, and sometimes even be capable of providing mainstream mental health services. So we're able to integrate the best of both worlds in the sense of a traditional Islamically centered perspective on life and health and wellness, along with the best of the rigorous evidence-based, empirically validated, empirically supported treatments that the so-called secular world has to offer. And working with folks who are trained in both the classical as well as the contemporary social sciences is really a treat for me coming from UIC. I think there are a couple other things that I'd like to mention just quickly, is that we definitely want to put priority on, let me say, the main issues that our communities may be dealing with. There's a whole lens of cultural sensitivity. There's another wider lens, which is behavioral and health disparities, which are occurring especially in the urban, indigenous, low-income communities. And this includes racial, religious, ethnic, and linguistic minority communities. We also want to be aware of, there's anxiety, there's depression, there's also somatic concerns, which really are a more accessible and non-stigmatizing way of referencing psychological concerns that we want to be able to tease apart. And by taking a holistic perspective on health, whether a person needs to articulate which may be an underlying mental health disorder through a somatic concern, talking to a primary care physician who's also psychologically minded, whether they talk about being sick and they're talking about really an emotional and a mental sickness which is impacting them, but they don't know the language and don't want to be involved with so-called mainstream psychology, or any other way that we can gain greater access and we can provide more effective and tailored services to the Muslim communities is important. And I want to underscore one other point that was made by the previous speaker, which is we want to suggest that Islamically centered social sciences, including but not limited to psychotherapy, is something that will definitely benefit the Muslim community, because why not use Islamically oriented models for Islamically identified populations? It just makes sense from a culturally sensitive, culturally competent perspective. But it's beyond that. It also involves offering this as a model of holistic, spiritually grounded wellness to the larger society and to the world as a novel, admittedly different for some, but we will suggest to you a very accessible and effective way of dealing with people that might offer a contribution to the mainstream knowledge about social sciences, psychotherapy, assessment, screening, and all the other services that are so desperately needed in these unprecedented pandemic times.
Amazing, Dr. Jalil. Thank you so much for your insightful conversation. You brought up various points of what we need to do for the Muslim community. And as we transition, according to the ONS Office of National Statistics report of early July of 2020, Muslims have the highest age standardized mortality rate due to COVID-19. How do you believe marginalized Muslim communities are disproportionately more greatly affected in dealing with this? What mental tolls do you see within your community as a result of the COVID pandemic? And further, what effect has COVID generally had on your community? I invite Hannah to begin this discussion.
Thank you, Monica. Yeah, so for the special needs community, they have been really hard hit by COVID. As you know, the other speakers have mentioned, the increase in stress, the increase in anxiety has been very paralyzing for these individuals. And for both children and adults with disabilities, there's been really a great sense of loss. So they have a loss of the structure that really helped them keep their lives together, the structure that kept them grounded, you know, knowing like every day I'm gonna get up, I'm gonna go to school, I'm gonna, you know, like just knowing that what's gonna happen next. And obviously that takes a toll on every person. Even, you know, for me, I have a hard time not knowing when this will end or what's gonna happen next. None of us do. But for, you know, these individuals who really rely so much on that structure just to get through their day-to-day activities, it's been, you know, just that sense of great loss and loss of purpose of what they should be doing with their day. And for the adults, you know, if they were independent before, they're feeling that loss too, because, you know, many of them have, you know, great fears of getting sick. Their health is already compromised, and they, you know, fear risking their lives by going, you know, back to work or back to their living facilities. Many of them, you know, maybe didn't drive, so, you know, the public transportation is a greater risk for them. So this, you know, is really, really taking a toll on their mental health, and, you know, just like their daily purpose that they have has been all taken away from them. So, you know, that's kind of what, you know, Mohsen is here. We have, you know, some support groups. We have virtual programs to try to help with some of that. We certainly can't replace their day-to-day activities, but, you know, we're doing some e-learning, we're doing peer buddy groups to help support, you know, just to have something to do during the day, like virtual, you know, activity nights, things like that, just to kind of fill their day a little and give them something to do. But yeah, we're certainly not a replacement, and so it's been really difficult for that community.
Thank you for sharing your insight on the community of differently abled Muslim individuals that you serve. Dr. Roxana, moving into the AMHP, tell us how COVID has affected your organization and you yourself as a healthcare provider.
Well, I think that as an organization, what we've found is being able to serve our community has become more challenging. So when you are uplifting certain resources that are directly, well, meant to be directly available to your members. So if we are uplifting certain clinics where people are being able to be seen for mental health issues or health issues, you know, that are really affordable, because a lot of our work is to increase people's ability and access to receive healthcare. And when those resources are either less resourced financially, but at the same time not available overall, then how can we uplift, you know, the community that we're serving, especially people who most need it, the most underserved? So that impacts our, you know, I think our organization in one way has been challenged, but at the same time, we have really found there is some ability to regenerate at this time in terms of how we serve the American Muslim community. So one thing we have done is really aiming to bring mental health first aid, for example, something we've developed in our own sense by utilizing a national model that was put out. You know, we've adapted that for our own work in American Muslim communities. And what we've done now through this time is tried our best to see where we can deliver that really, through telemedicine. So how can we do that? You know, we've been working through other organizations to get that out to communities that are, you know, only able to receive anything remotely. So we are looking at new ways to deliver, I think, mental health and healthcare, where perhaps whether or not it was available before in person, maybe through remote access, we might actually be able to reach more people. So we've learned different aspects of our own work, I think, that may even show us how we can reach more people. I also think the aspect of being a mental health professional at this time is really important. By your own personal anecdotes, something I've been gathering through colleagues, but then of course through my own work, is, you know, loneliness is a factor that is impacting people across the board. So we know that it impacts the patients we see, but it also impacts the healthcare professional themselves. So when we work in silos, it's harder really to converge and be able to share your experience and process trauma that you experience as a health professional. So if you have those associated factors of trauma, and maybe you've taken on experiences of trauma by working with families that have suffered the loss of family members because of COVID-19, but also people who are really suffering under this lockdown and not being able to access resources. For instance, someone who has PTSD may not be able to receive resources through their provider as they were, which really, really aggravates that condition. So, you know, in terms of psychotherapy or just being able to attend a group. So when you have all of that, you take more on as a healthcare professional. You're really having to vicariously experience what everyone else is experiencing. So and then being isolated overall, really has an impact on the individual. And I think that's something to be checking in with constantly as a healthcare professional. You really don't realize the impact of the isolation, the caring for our own families, but also not being able to give and offer the resources you were able to give to your patients as an option. That really takes a toll on that professional, whether it's a medical professional or a healthcare or a mental health professional. And, there's a helplessness that comes along with that. And I think there's a constant checking in you have to do in terms of your own self-care, but also you have to find these places that you can connect with other colleagues to process some of this helplessness you might feel during a pandemic. And also not being able to assist your patients in the ways you are accustomed to. So I think that answers those two questions. And anyone else, of course, can add to that.
No, you basically summarized the severity that COVID has had on the Muslim community perfectly, Dr. Oksana. And you have brought us into our next question, that 1 in 4 adults and 1 in 7 children in the United States have some form of disability, according to a 2018 report done by the CDC. During this period where shelter in place has limited the accessibility to assistance, how has your community of differently abled clients been affected? Have you noticed an increase or decrease in mental state and function? Hannah, you touched on this, but I would like to hear more about what you have experienced in your organization.
Yeah, sure. So we definitely see ableism quite rampant. And for people who are not really familiar with that term, it's just discrimination in favor of an able-bodied person. And I think that just happens a lot because people, I don't want to say ignore, but tend to forget about the disabled community, especially like when they're making decisions. If you're part of an organization, if you're part of a board or government that's making decisions, you're going to see the world through your own eyes, and you're going to make decisions based on that. So, that's ableism, because you're not thinking about everyone who you're leading. You have to think about everyone, not just yourself. And the statistic you said, 1 in 4, that's a huge number. That means 25% of the population in the US has a disability, and they definitely need to be factored into the decision-making process. So, a couple examples I can give is schools. So schools are basically compensating, by doing e-learning. So e-learning doesn't suit children with special needs. They have a hard time with that. There's sensory issues. They need all the supports that schools provide. Schools provide speech therapy. They provide occupational therapy, mental health, social worker. All those things that help support those children throughout the day are not going to be available through e-learning. So, as these school plans are coming out, you see a lot of school plans are rolling out now that we're getting close to the first day of school. You can definitely tell which school districts did consult with their special needs teachers and which ones did not. You can see a difference in the way those plans were rolled out. You can tell, okay, this school district definitely had a special needs teacher in that room during the decision-making process. And so I would really encourage that for all school districts and any organization or company, or, if you're on a board, I would really recommend that you have someone with a special need to have a voice in that room, because the number 1 in 24 is not a small number. So even if you don't see every day, you don't see a person with a disability, that doesn't mean they are not existing in your community and that they shouldn't be thought of when you're making any type of decision or policy. Even if you think about, policies around reopening companies or reopening stores. You see some stores have these special needs hours, right? Like, I'm sure you guys have seen that there's, special hours in the morning or evening time where, they close it off and only let like compromised or older, the older community or special needs community come at that time. And that's really great. And I really commend that, but it's not enough companies doing stuff like that. It should be everyone thinking in that way. Even especially in government, when they are making these policies around COVID, and even the stimulus check, getting the stimulus check was a battle for those with disabilities. There was a whole fight in Congress just to get this community a stimulus check. So again, that voice needs to be on every board, on every school board, to just voice for this community what the needs are, so that when they are making those decisions, that they are considering everyone.
Thank you, Hannah. I can only imagine. I remember taking a class in undergrad for policy, and one of the papers that we had to write and really look into was the ADA compliance. And walking through Iowa City, I realized that we are not ADA compliant in most things, which is just sickening to me. And then also with this current pandemic and social unrest, I can only imagine how it's just been exacerbated because of what's going on around us. I can only imagine, and I commend you for the work that you do with the community, because I know it must be difficult.
Thank you.
You're welcome. Moving into question 4. According to a 2018 study done by the American Psychiatric Association, 60% of the Muslim community have experienced some level of religious discrimination, which surpasses the amount of other religions have faced. How does Islamophobia relate to mental health issues today? Today, amid social unrest and profiling, how is the Muslim community being affected? Is there a level of re-victimization or of PTSD whilst watching or participating in the aftermath of the most recent events? Dr. Jalil, in your work at UYTC, you are assisting adolescents who are exposed to violence and as a result often psychologically affected. How has the current social unrest been observed in your practice?
Thank you, Monica. Similar, probably everybody else on this panel, the unrest has gone everywhere, and the impact is felt at multiple levels. And I work across the continuum of care, from intervention to prevention, in clinics as well as communities, as well as working with those who serve young adults, as well as overall family-focused perspectives. So I get to see the range of situations in communities, and I can say the unrest impacts everybody. Now, it's complicated, worse, beyond the communities I mainly serve, which are the low-income urban minority communities, when you're Muslim and you're experiencing Islamophobia piled on top of that. Now, Islamophobia makes it much more difficult to process the stress that everyone is feeling through this pandemic. But on top of that, the institutions which should serve you are either ineffective or, in some cases, unfortunately, even contribute toward the stress and the traumatization as they outreach or interact with you, such as police brutality situations, such as stigma when you come inside emergency services, such even child protection agencies may say, well, you and your kind really don't understand and don't raise kids properly the way we do. So even if you raise your voice, you're raising your voice, for example, because of your religion, teaches you to be insensitive, and that means you're probably a worse parent. Now, they could see the same interaction with someone else, but because there's Islamophobia or Islamically, or I should say a distorted lens, when they look at Muslims, they may find more pathology there than it actually is. That corrupts your assessment and your treatment, because if you don't understand what's going on, how could you ever treat it, right? And then on top of that, when you're looking for services, even if you're sincerely looking for services from a culturally sensitive perspective, if there's not this plethora of models, if there are not a range of substantiated techniques that you can use with someone who identifies as Muslims, then inevitably you're limited in the impact that you could have. So I think Islamophobia complicates things, it exacerbates things, and this is on top of the pandemic that everybody is going through. Now, if you're a Muslim seeking out services and you don't feel comfortable approaching mainstream institutions, I also do work with communities that have been described as undocumented. So even if you need services, even if the hospital may be down the street, you're not going to go there because of your fear and your anxiety of not just the pandemic conditions, but because the institutions which are supposed to serve you actually might oppress you or prosecute you because your paperwork is not in order regardless of your particular needs. And from an, you know, when you're dealing with Islamophobia, then you have inferior care because it's not sensitive to your needs. And even if there's an opportunity to serve you properly, because I view your religion or your identity as a problem or the source of most, if not all, of your pathology, I'm not going to address the human condition that you may be facing. And so this really gets in the way. Now, I'm happy to say that this sense of social justice that you see bubbling really has bubbled over in the streets, has also made its way in a painstakingly slow way into the academy. So you do see an increased call for cultural sensitivity. You do see an increased call for a general, let's say, anti-Islamophobic perspective to root out bigotry and discrimination and justice toward those who identify as Muslim. And that also means you need to have retraining or proper initial training that also is beginning to make its way into the academy. Now, I won't sugarcoat things, that we have a long way to go. I mean, a long way to go. I'm also encouraged and inspired that there are people who are taking those steps, and this panel can play a role in that, I hope. And all of the organizations which are listed here are contributing, chipping in toward hopefully a collective differential outcome where you have more culturally competent, culturally sensitive, and rigorously, let me say, empirically trained, qualitative and quantitative, on how you build the best of the available sciences and you tailor it and individualize it to specific communities' needs. I hope that we have more of those who are not only coming through the graduate programs, but who are also being able to retrain themselves if they're practicing professionals. This is an uphill battle, but it's a battle that I do see us beginning to collectively wage. Now, piling on top of these pandemics, there's history. And I'll make this brief. I actually put myself on the clock because I have a lot to say on this, but you know, allow me one more minute. The Muslim community is dealing with microaggressions in terms of those day-to-day interactions, those slights, those comments and different things. They also deal with macroaggressions, which actual direct physical violence. And this is not something new, whether the violence has been verbally threatened or is physically imposed. It creates a sense of insecurity, which contribute toward internalizing disorders, as we call them, depression, anxiety. It can also create one I want to mention, which are the externalizing disorders, which are people can become aggressive and reactive. Now, if you look at it, it look like, well, this is just a crazy person who just attacked people, they just snap. Well, actually, there's a whole historical, ideological reason that they were actually victimized and lashed out in a maladaptive way that would never get looked at, because they'll say, well, you were just violent and you were just a criminal and you just hit this person or you just cursed this person out. And that's something that we as social scientists have to begin to unpack and uproot at its cost, so we won't have people who are misdiagnosed, misperceived, and also then subsequently mistreated. And I will say very quickly, religious discrimination, Islamophobia is not new. You know, Spanish banned people who were Muslim long time ago, African slaves who practiced Islam, especially from primarily West Africa. They were the ones who were looked at as the ones who had to really crack down on the most, because they were the ones who also participated in some of the slave uprisings. Should we use our term protest, unrest? Well, there was social unrest back in the days with Muslims who were trying to seek out justice. And when you're challenging a system of white supremacy and racism that this country's slave trade was based on, then you definitely are going to bring back political repercussions. So I will wrap up and just say that we have a role to play, and it's a challenge to us as social scientists and therapists and practitioners to say, well, how can I help with protests? How can I help with unrest? I don't have a role because they're not coming inside my office. Well, I will challenge us to say, they're not coming inside our offices all the time, but we can go out to the communities, out to the messages, out to the organizations, out to the schools, not only the Islamic schools, but also the public schools, and make ourselves available and give people the appropriate adaptive coping resources, so we can not only address the pandemic impacts, but also we can address the historic context of Islamophobia. And this now means we have to be just as good virtually, as one of the panelists spoke on. We have to be just as good virtually as we are when we see people in person, if we ever return to whatever is going to be our new normal. So we have a lot of work to do, but you know, from an Islamic perspective, we feel like we'll always have the resources we need if we have patience and constancy, so we can challenge this.
So Dr. Jalil, you are here in the city. You're here right in the heart of most of where there has been such social unrest. And you're advocating to come out and speak, and that's amazing. But I have to ask you, Dr. Roxana, you practice out in the nation's capital. How has your community and clients been affected? Because you're right near the White House.
Well, that's true. And I think, you know, I think that's an important point to be located here. But one thing that we have seen, and I think this speaks to Dr. Jalil's point as well, is that this is a national, you know, nationwide wake up, really. And there's really no other way to describe what has happened. And I think I have talked to many scholars and colleagues, and what we have all, I think, conceded is that there have been few moments like this in history where we can see that something is changing in our social climate that is both, it's a struggle, but it is moving towards, again, some kind of regeneration. And it doesn't happen often. And I think being here in DC, you feel that motion and that movement. But when I talk to colleagues across the country, they almost seem to feel the same thing. And they hear the same thing from their patients. And they hear it from patients across backgrounds. So this includes American Muslims, this includes non-Muslims, this includes, you know, Caucasian Americans, this includes all kinds of races, to kind of understand, where are we allied? How can we uplift Black voices? How can we understand the struggle and not just, you know, deem it as a group of people that are resilient, because that also can get, you know, that can undermine the process of what we're going through. And so I think I'm hearing it from all kinds of places, and being here, you know, it's definitely my inclination to understand what's going on also across the country as being similar, and how unique it is in this moment. So I want to just add to Dr. Jalil's point here, where, you know, he has talked about the impact of Islamophobia. And I think that also coming from the place we are in this moment is also just to understand whether it's Islamophobia or we're understanding where anti-Blackness comes from and this experience of discrimination. We just need to ground that, I think, in the sense that discrimination and racism across the board is bad for our health, right? For any individual's health experience. And then, of course, comes mental health. We know this through research. We know this through multiple nationwide research studies, starting with the ACEs, you know, study, and beyond that. You know, that racism itself, entirely in whether it's one incident, but more so accrued over a lifetime, or discrimination, is going to have negative impact and outcomes for an individual's health. And that will lead to mental health complications. It complicates everything, really. And I think as a mental health professional, you know, I feel a duty to really kind of underscore that, because people don't come into our offices anew, you know, with the impact of one event and then suddenly change. We know that it's a lifetime of experience of discrimination and prejudice that is going to impact the moment they come into our offices, or if we see them remotely, or if we see them out in the community in some other function. So Islamophobia is within that. But I do think, importantly, underscoring that 20 to 25% of the American Muslim community is part of the Black Muslim experience. And knowing that they are realizing a sort of compounding and confounding amount of factors at the same time, now with the social unrest issue, and then, of course, increase in divisions, and then both receiving maybe support, but at the same time being asked to talk about their struggle in a way where maybe it doesn't feel right to them all the time, because it feels like you're explaining something that's been there all the time. You know, so I think this complicates the mental health position of a good portion of our community, and it's really important to understand that as we start this discussion, and that you know, as we look at disparate outcomes of health, we always need to couch that into the experience of discrimination and prejudice along a lifetime. So I think that's something that I think is important today, as we see the next pandemic that we will see with communities of color, the Muslim community, and any community that really has dealt with this long-term experience of discrimination, in that the mental health impact will be profound, really, and we have to be aware of that as we move forward.
Thank you. I'm very appreciative of both you and Dr. Jalil's comments regarding this social
Monica,
unrest. I'm sorry?
Can I add one other
Of course.
thing on this point,
Yes.
given its importance, and I apologize. I'll make it quick. I think when you're
As long as
serving,
it's not Dr. Jalil.
I think when you're serving the Muslim community, there's another element, which is now you see there are certain segments of our communities which are dealing with the multiplicity of pandemics. So my work has primarily been with low-income, urban, ethnic minority communities who have had excessive, intensive violence, not only within the community, but from their own, from the institutions of mainstream society, which is reflected in, but not limited to, police brutality. Now, we have another dynamic in the larger community, and we'll connect it to the Muslims, which is intergenerational transmission of trauma. So when you have one person or one family or one community that's been traumatized, it's hard enough to bounce back from that. And if they don't get the proper support and healing, they might pass on some maladaptive behaviors or concepts to their children or people in the family or community around them, and it gets passed along. So then you're at an even greater disadvantage, the next generation, for trying to overcome those same chronic obstacles, but with less amount of resources. So there's intergenerational transmission. Now, bringing the Muslim community, you have multiple traumas within a generation, because I've dealt with some communities that are war survivors. So they've come to the United States after already experiencing, for example, a civil war in Syria or Africa or other places, and now they come to communities that are experiencing their own community and interpersonal violence, and they come and they almost feel like I came from one war and now I've been immersed in another. And even worse, I'm not as socially connected to the resources around me because I may not speak the language, or I don't speak it as well, or I don't have these strong family and community ties. So I'm faced with even more violence, or an equivalent amount of violence, with even less access to resources. And the people I do bump into are not sensitive to the fact that I'm dealing with this multiplicity of factors that they either don't know or don't fully understand. So intergenerational transmission of trauma, plus the multiplicity of traumatic experiences, really presents an incredible challenge. And this really gives an opportunity for us to look at what's the indigenous Muslims community's experience, because some of them are dealing with multiplicity of traumas. And paradoxically, you have some Muslims who've come to this country very comfortable and have stayed very comfortable. And this is where the class aspects of experience come into play, where they're disconnected from and sometimes shun the struggles of other indigenous communities, especially indigenous Muslims. And so what happens is, now their kids are caught up. Now their kids are experiencing the disruption, and their families experience disruption. And because they've not acknowledged this context, they're not aware of these factors, there's a whole lot of hurry up to catch up, where they're scrambling to try to understand what their kids have gone through and now going through at a more escalated level. So the challenge is there. Again, staying positive, okay, I see an intensified approach to continuing education for professionals, public outreach and public education, psychoeducational opportunities, groups which are gathering to discuss these issues. So I'm very pleased that I see a response, but I won't deny that there's that complexity of challenges, especially with some of the kids that I've dealt with. They feel like they're really re-traumatized because they're looking on their streets and they're seeing a very, heavy police presence, a set of very militarized units, and it reminds them of some Civil War situations that they just came from. And you're dealing with indigenous communities that have seen the heavy police presence, harassment, discrimination, stop and frisk, and other things which have been happening for a long time. And trust me, in Chicago, we have a very sordid history of this type of thing going on. But good is being exposed. And I do think we're responding.
I appreciate that, Dr. Jalil. You're correct. The police presence here in the city is just it's grown because of the current social unrest, but now that we have the Fed, and then for a while we had the National Guard just sitting around, I myself was just taken aback and thinking, oh my goodness, I've never experienced this in my life. And I can only imagine what the children and adolescents that you deal with are feeling at this moment, because if it's something that they're so familiar with from their history, and they're coming here to this promised land of opportunity and freedom, I can only imagine how it can be just completely sickening and nerve-wracking and emotionally just jittering. So that brings a great transition into our final question. So as we begin and become accustomed to this new norm of pandemic and social unrest, we ask ourselves, what needs to change so we don't repeat the past? What is the most critical change that we must make to face the future effectively? As a recent graduate and concerned young adult, I'm unsure of the role I take in the discussion of advocacy and approaching this new norm in an effective way. Today, we are joined by many young adults like myself with that same burning question. As organizational leaders and advocates, I ask you for your pearls of wisdom so that we, the voices of tomorrow, may begin the change. And you guys can take this one as a discussion, or whoever wants to go first.
I can go. So, and I just kind of want to add to that discrimination topic as well, as I kind of close out. So, you know, in the special needs community, children of color are really grossly underdiagnosed as well. Those children are not getting the therapy they need early on when it's really critical. So that's something I really want to bring up and talk about, because children of color, when they act different or show signs of a disability, it's always blamed on behavior, on their upbringing, which are just completely wrong. And those kids need to get the help that they need. They need to go to the doctor and get a diagnosis instead of being labeled as behavior problems. So that's like one of the big things that I want to close out with, and changes that we need to make is to, you know, recognize that that community definitely needs extra help in diagnosing and getting help early. And even with the police brutality, there is such a large percentage of, you know, people with cognitive disabilities being the victims of police brutality, you know, and there just needs to be awareness, you know, and training for the police to know, like, if they're dealing with someone with a cognitive disability, and maybe they can't follow your exact directions or whatever it is, that training needs to happen. So I just wanted to close out with that. And for, you know, people asking, like, what can we do? Again, like I said, that voice of a special needs individual needs to be there in decision making. So if you see decisions happening around you without that voice there, make sure to find someone that can, you know, speak for that community. And if you don't know anyone, reach out to an advocacy group, like such as ourselves, or there's many other advocacy groups, and ask for help, or ask, like, hey, what do you guys think of this policy that we're rolling out? Do you think it would be suitable for, you know, individuals with special needs? And that's something that, you know, everyone can do when you're, you know, in a role of a person making a decision. And if you're not, then just reach out to your friends and neighbors and see if they're okay during all this time, you know, during this pandemic and social unrest. People with special needs, they have a hard time going out. They don't socialize as much. So just reach out to them and, you know, see how you can help. So that's kind of where I'll leave you guys with today.
Hannah, a follow-up.
Sure.
You talk about police brutality with
Mm-hmm.
the special needs population, and we are in the wake of police reforms. So what reform do you want to see for your population?
Yeah, I definitely want to see, like, awareness trainings. I want that to be, you know, something way up high on the list for, you know, police to be aware, like, what signs to look for in an individual when they're approaching, like, what kind of sensitivity training can they do to understand that this person has a cognitive disability. So you can't expect the same level of, you know, cooperation. And it may not be that they're not cooperating, they're just, you know, they're different and they're going to react in a different way, and they are probably not a danger. So that's the kind of training that, you know, and reform that I would like to see.
Awesome. Thank you. Dr. Jalil or Roxana?
So I'll go ahead and, this is echoing a little bit of what Hannah said, but I think, the issue of what critical changes we can make, I center it a little bit around my own profession as a psychologist. And I do think that mental health treatment and the mental health workforce really does need to change. And, I'm really speaking about the psychology workforce because I know that in my own world of psychology and psychologists from the APA, we have a very small percentage of racial and ethnic minorities that make up this workforce of psychology, and in what the APA reported as recent as 2016, it's well over 80% that is white in terms of the psychology workforce. And they do find that there's just not enough multiculturally competent mental health work and treatment out there. And, this is a profound problem as we face the future that we see of minority communities, people of color, the American Muslim community, Black Muslims, Black Americans, all kinds of communities that are going to be dealt with really the worst hand during this time. We'll be seeing the impact of this in 2 to 3 years at least, where we'll really come to see the mental health piece. We need multiculturally competent mental health professionals in the field to understand these issues of chronic discrimination, stress, intergenerational trauma, as we've heard so eloquently, and to understand that this is part of the work you do as a mental health professional in order to serve communities in your own city, in your own neighborhood, that this comes to your door in so many ways. And by not recognizing that within our own profession, I think that it's almost like we're putting blinders on. And I do feel that this is one of the most critical changes that needs to happen. And then from there, hopefully advocacy for direct service to these minority communities will come from that. The more people that enter this field and we remove those barriers that are systemic, really, I think in many ways, we will have an opening up of treatment for the people and individuals that have not had it for multiple reasons that were completely out of their power. And I think we need to work on that specifically. And I hope that health and mental health can coordinate the different industries and the different, individuals from the ground up to make that happen. So that's my perspective here.
Well, my follow-up to you, Dr. Roxana, is, and I hope you don't mind me disclosing this, but you are the most well-educated individual I've seen. How do you, as a female of color, recommend for females such as myself and those around me to push and to be as effective and outspoken as you are?
Well, I think that's one thing that you're pointing out, education and the access to that and the ability to receive that. We all have to recognize whatever pathways we were given in a privileged sense to have that. For instance, my parents are immigrants who came here from Pakistan and Libya, but they wouldn't have come without the Civil Rights Act happening before them. So I have to recognize that in my educational journey and learn how to utilize that journey and to change the course of other people's journey. Of course, as a Muslim, I'm informed to do that and grounded to work towards social justice for all people. But really, it's the journey that you go on that's going to open it up for others and that you reflect on. And I think women, as an American Muslim woman, you have a unique position to change minds and open up conversation, because perhaps traditionally that is not something you were given. But now that you're in a place where people are actually, listening to people who maybe they have the education, but as an American female voice, Muslim female voice, use that opportunity when you can to uplift and pass the mic to whoever it is. I like to say that for my younger students, to whoever it is that really needs to be heard. So I think that when you pave a path out for yourself where you are intending to do that and you align yourself with that idea, you know, paths open up somehow because your intention is there. And I think, you know, everything else will get you to a point to make other people heard, especially if that's your intention. So that's what I would say about that.
Thank you. Now following into Dr. Jalil, what have you to say?
Thank you. I have a few thoughts and suggestions. One is I would strongly advocate for us to have further enriched integration of traditional sciences in Islam, as well as the social sciences that are available to us in the US educational system. And that starts from preschool all the way through postgraduate, postdoc, and carrying into our professional careers. You know, from a Muslim perspective, and I'm someone who's a convert to Islam, so I know what it means to like come into Islam and discover things. And I have felt the mission to integrate my own lived experiences and realizing the, as we just mentioned, the privilege and the preciousness of education, especially rigorous education that has a strong upward trajectory, okay? Combining that with the holistic perspective on health and wellness that comes from ilmu nafs, you know, the knowledge of the soul that is reflected in our traditional sciences that we've had for 1400 years. And of course, Islam is real, it's relevant, it's not for the museum, it's actually for mental health practice. And I have seen that benefit and I support that benefit. And I don't think you have to compromise either one. So if we're pursuing, you know, our MDs and our PhDs and our, you know, our higher degrees, we can still get traditional Islamic training to integrate and enrich what we're doing. And as a matter of fact, as a Muslim, I would say I ground it in Islamic knowledge and use that to project forward and hopefully contribute new perspectives to what's the so-called secular social sciences. I don't think you have to choose. And if you are a Muslim and you really believe you want to serve for the sake of Allah, you should know the best of what's out there in terms of the tools of service so we can really make an effective attempt to address all these multiplicity of problems that we discussed both previous to this pandemic and the things which continue to escalate. Secondly, I would suggest, and I hope my academic colleagues won't get offended when I say this, but like they say to the kids, you keep it real, all right? If we're gonna be professionals, we have to respect community wisdom, respect lived experience. Some of the best experiences I've had have been working with the so-called low-income, oppressed urban communities that seem like they're just can't get anything right and they're impoverished and nothing's going on. And I've met some of the wisest, non-professionally, graduate school persons who've contributed immense insights that only comes from lived wisdom. By the same token, being able to access mainstream institutions and their resources, their grants, their databases. These are really opportunities for partnership so we can really combine community wisdom with the academy and its best of the training practices, so we use those best practices. On that note, a third thing from the Urban Youth Trauma Center, we really believe everybody can do something. And this includes from the youngest to the oldest. So from an ecological perspective that looks at health holistically, we think there are 5 things. I'll summarize them quickly. 1, we have to support survivors of trauma. And we have to support them with a trauma lens. And stop always asking what's wrong with you and start asking what happened to you so we can be better providers. Secondly, we have to support adults to support the children. This includes caretakers, but also those extended adults in the communities who really have to take ownership in meeting the kids where they are, understanding them in their own language, and being able to provide that guidance that they can't do when they're 6 or even they're 16, I'll suggest you even 26, that we should be able to contribute toward breaking some of these chains and cycles of intergenerational transmission. But it's not going to happen if we dismiss youth. It's not going to happen if youth don't feel like they can approach us. And we have to really meet in the middle to work together. Third, we have to develop youth's individual skills. Now, I work with some of the kids who you will hear about as those hardcore gangbangers. You know, there's nothing good in those thugs and this and that. Every single kid I've met and their parents has always had some gift or some skill. And if we take a strengths-oriented perspective, we can probably support them developing pro-social skills so they have less reason to indulge in the antisocial ones. So finding the gift, including the gifts which are enclosed in the cursing you out, the people who won't talk to you because they're traumatized, reaching through the difficult obstacles to service engagement, to be able to involve them in their own empowered self-development. This is critical. So if you take a strength-oriented perspective, everybody's got a gift. It's the job of the professionals to pull it out, cultivate it, support it, and connect them to other resources in their community so there's continuity and stability. Fourth, we have to establish a sense of safety. So you got kids who are in some very unsafe neighborhoods, and I'll suggest you there's also unsafe homes inside those unsafe neighborhoods. And they've been exposed to interpersonal violence from an early age, some of them even in the womb. We have to be able to reduce or prevent that type of interpersonal violence so they can maximize their development without having fear of emotional or physical damage. Last but not least, the fifth thing is we have to change cultural norms. That means norms around things like community violence. This includes that it's okay to brutalize or kneel on someone's neck for over 8 minutes until they choke to death in front of you. And that's okay because it's those people or it's that community or it's this historically oppressed group. It also means we need to change the norms about what does it mean to access mental health. So if I think the only reason I go to a psychiatrist, psychologist, licensed clinical social worker, or another provider is because I'm crazy, there's something wrong with me, and that reflects a weakness in my family, that reflects an immorality, that reflects that I'm not a good person, I don't deserve treatment. These are things that can stop us from accessing services that we need, and that's dealing with these norms of stigma. So the more we can get out of our offices, go into the messages, work with the religious leaders, also have them come inside our academies and give us training from their perspective. Also being able to have public forums like this where we address mental health issues and say, there's a way that you can get some help and the people who will help you won't just stigmatize you or demean you. These are all what I would consider to be chips that we can make in these obstacles to us being able to be developed. So join the struggle.
Thank you, Dr. Jalil. And I think my follow-up question is of personal gain, but as a social worker, I am going to walk into these situations where I'm going to have a lot of pushback in talking. How do you think that I should approach this? And how should I come about the community and say, like, I'm not here as a person of, like, I have privilege, but I want to help you. How do I approach?
I think acknowledging that like you just did is a first step. I mean, people need to hear truth and they want to feel sincerity when they're interacting with you. And just being able to now openly talk about white privilege. And as a matter of fact, one of the groups that I'm a chair of, the Community Violence Committee, National Child Traumatic Stress Network, they've taken on the notion of white identity and white privilege amongst European Americans. Being able to discuss that openly, that means something. You know, that establishes a trust, that acknowledges the world around you, or I should say the centuries which have passed before. And that says, you know, it could put in someone's minds like, hey, this person seems like they're going to be honest. It seems like going to be real. At the very minimum, they're talking differently than some other maybe mainstream mental health providers have been talking. Let me give them a chance. I will combine that with this though, is they're going to ask you to talk the talk and walk the walk, right? And believe it or not, just so you know, I will get tested. Even if I'm dealing with Muslims, I will get tested, even if I'm dealing with my African-American community. I've never had a free pass because they want to know, look, you're working for these mainstream institutions. Do you really understand where we're coming from? Or are you like them? You know, are you really going to, you know, maintain that cultural humility and respect for coming into my neighborhood, coming into my home, coming into my family? Or are you going to be one of those people who you got your fancy degrees, and so you're going to come in here judging us, talking down to us, dictating to us rather than collaborating with us? And they're going to watch. And as a matter of fact, I encourage them to do it because we do need more cultural sensitivity and cultural humility as we approach these communities. And you might be dealing with that manifestation slightly differently, but trust me, anybody who's going to allow you to help them is going to test you to make sure that you have good intentions, and they're not going to test you just in the beginning. As we talk about from not only engagement, we talk about retention, not only recruitment, but retention. They're going to continue to check you and test you as they reveal more, as they disclose more, as they talk more, as they show you their warts, as they start arguing, as they start raising their voice. So you can break through that by hanging in there and staying consistent, by offering that you're humble while you also have some expertise that you can offer that they may not have. And I think that type of partnership paradigm is more what we're looking for. And if you can hang with the testing, you won't be the only one. You know, I will suggest you probably make a dramatic impact. And I've talked to persons of color. I'll just say this and then I'll stop. I've talked to many community members, and they've talked to my students, they've talked to my colleagues. They say, you know what, that person over there, they're not African American, you know, they're European American, they're white, but when they came here, they respected me, they helped me, they hung in there with me, they sincerely showed me they were trying to serve me. I trust that person, I like that person, I want to continue to work with that person. So it's not insurmountable, it's just hard.
Awesome. Thank you. Thank you to all of my panelists for just answering my questions and being so amazing. So before entering our Q&A portion of the afternoon, I want to thank each and every one of you for joining me. It has been my pleasure to be your moderator. And please always remember, there's no shame in speaking about your mental health. May God bless each and every one of you with health and wisdom. I invite you to stay and ask questions, but this concludes the hey, checking in. How you doing? Addressing mental health awareness. Peace and blessings be upon you.
Thank you so much to our panelists. Our minds hopefully are not just only thinking more critically about where we are in the state of mental health during the current pandemic and just everything, as rightly noted, in some people's lives, we're talking about centuries worth of trauma, intergenerational trauma, to where we are in the current moment and the possible solutions for that. So I really am happy with some of the questions that we received, because it really speaks to people who are really critically thinking about the state of mental health and where we are not only in their profession and in care, but also where we stand in thinking and hopefully being proactive and making sure that we can take care of ourselves and hopefully share this information forward. So a few questions here. Let's start with the first one. This is on behalf of our beloved Professor Mo Haskins, who is Monica's advisor. I'm sure he doesn't mind me introducing him as such. In regards to mental health issues, would drug addiction and alcoholism be included? And so I'll leave that question to be open to any of the panelists that would like to answer
that. I can answer that. I think the question is whether they are included under the umbrella of mental health issues. Am I understanding that right?
Absolutely.
Okay, so I mean, I'm going to assume that's what it is. I absolutely believe that, and it is considered a mental health disorder if you are suffering from addiction, if you're suffering from some kind of substance abuse issue, and it becomes whether dependent or addiction or really struggling with it as an illness, really, and that's how it's been seen in the Western model of medicine and mental health, I suppose. So I think what's important to know about that is, you know, during the pandemic, we have seen really people struggle who have already had substance abuse issues or alcohol-related concerns with using or an issue of excessive consumption or whatever it is, because this factor of isolation and very little connection to the outside, where it's really might just be remotely through the phone or internet, you know, there is less resources overall for social support. When you have reduced social support, you will go into coping mechanisms that are previously known to you. Now, you might have had some progress, but when you're not able to seek out that person that has really brought you a lot of solace or support in order battling an addiction, that is going to be a real compounding stress factor for substance abuse or alcohol abuse, because you are struggling to utilize what you have known to support you through it. The other thing, of course, is access to other places and areas or, you know, other types of hobbies and interests that brought you some solace. Many people can't engage in that. You might find ways to try to do it at home, but you know, if you are outside more often and you're visiting certain places, even places of worship like we know our own masjids, you know, this is a huge factor. Not being able to access that could lead you to an old coping mechanism. And it's a really important factor about knowing how the pandemic has impacted people.
Thank you, sister. Thanks for that. And then I'm glad that question was asked, because there's always this stigma and probably more than likely personal shame for people to even come forth and to, one, acknowledge and admit that they have those issues, but even to understand how to even deal with that, especially when it's so like downplayed as it's your fault. You can do better. You can quit cold turkey, all those different euphemisms. So that hopefully is a stepping stone for us to hear that. Thank you, Rosanna. The second question, this is actually directed to Sister Hannah. How can we, as the Muslim community, better support our differently abled brothers and sisters? What methods have you seen that you think are effective?
Yeah, thank you for that question. So just as a community, even being able to talk about this topic is a bit new. So, you know, our organization is actually only 5 years old, and I've seen such a change in, you know, the community as far as like the way they talk about disabilities and the way they've accepted those with disabilities. It went from being, you know, a really strong stigma where, you know, people wouldn't even tell that they have someone in their family with a disability to now being, you know, able to get help, talk about it, and not feel like any sort of shame about it. So I think as a person, you know, the way you can help the most is really just to be accepting and making sure, like, you know, your community, like, for example, if you're part of the Muslim community, I'm just giving an example, make sure like your local mosques are including people with disabilities. We actually have a program, a Muslim program that, you know, goes to each mosque, and we like have all kinds of like, you know, speeches and awareness events and youth trainings on how to, you know, work and include people with disabilities. So, you know, you could look if your local organizations have something like that. The other thing you can do is volunteer with us, and we have volunteers all across the nation. So we are based in Chicago, but our volunteers are everywhere. We have chapters all across the nation where we could definitely use the help. So if you go on our website, you can sign up to be a volunteer. There's all different kind of volunteer opportunities. You can do something called Respite, which is, you know, and this is probably when COVID is over, but you go to the caregiver's home and give the caregiver a break while you know, watch the person with a disability and spend time with them. The caregiver can go get a break for a couple hours in a day. And that's such an important way to support the community, because those caregivers really need to get some breaks and some time away. So there's that program, and there's a lot of other volunteering opportunities that we have. There's Peer Buddy, and Peer Buddy is even virtual now, so you can even do that. You know, just go online for 1 hour and, you know, spend time with someone with special needs and get to know them and, you know, just be their friend.
I have to pretty much applaud Mohsen. I learned about the organization
Thank you.
pretty much in its infancy, and no, you're most welcome. And the story, just how this organization came into being, exactly that, to really address the lack of accessibility and understanding within the community. So hopefully that work continues, and more so specifically, it could be a model not only for the Muslim community, but for our entire society, because you guys have been really doing.
Yeah, I don't want to like
stuff.
pinpoint it just to the Muslim community. I was just
Right.
using that as an example. So I want to make sure every community, you know, has something like that. And you can volunteer for us, like whoever you are. We're not, you know, looking to just for Muslim volunteers or anything like that.
Duly noted. Thanks for that, Hannah.
Mm-hmm.
The next question is coming from an aspiring medical student hoping to enter the field of psychiatry. And she asked, what concrete actions can I take during my medical education to promote multicultural awareness and dispel stigmas against mental health in the Muslim community? That could be open for anybody.
I know I can speak as a psychologist, so I'm not in psychiatry, but I think that what's important to know about dispelling, stigma against mental health within the community is to work within the community as much as you can. And I think, sometimes when you are working, across diverse communities, sometimes you're almost unaware of the different ethnic and racial makeups of the American Muslim community, directly by just kind of going through your own education. You don't learn as much about the diversity, and you're not in every community. And I think going out, seeking those experiences, like if you understand that the Somali community itself specifically has certain concerns and beliefs and values when it comes to their health, you want to understand that ethnic group and that cultural group rather than tying it in as only part of the Muslim community. So we have to recognize we're a heterogeneous, community. There are so many different aspects to the different ethnic and cultural groups that make up Muslims in America. And we each have our own cultural beliefs as it comes to mental health. And one cultural group might have a completely different perspective on how to cope and deal with mental health issues. And my experience as a psychologist working within the community and then across the cultural lines is very unique. And it's unique for each family too, and I think that's a big part of learning how to work within our broader community is go out into different ones, understand the specific cultural relating to mental health, and then try to incorporate that into your practice.
And I might add, if I could.
Please.
So I'm a clinical psychologist, but I'm on the faculty in the psychiatry department. And I have the privilege of being part of multidisciplinary clinics, and I used to direct one myself for disruptive behavior disorders. So I can say from my 20 plus years at UIC that the medical degrees, general practitioners, as well, all the way up through the child psychiatry fellows or adult psychiatry fellows, there's a tremendous role in the medical school curriculum to incorporate these same issues at a fundamental level. I think some of the ones that kind of pop out at me, there's certainly community psychiatrists of which I've worked with who do their practice, but they do it from more of an ecological perspective, which includes but also transcends medication management, keeping in mind behavioral health disparities, as it's been mentioned, and things like the ACEs that can spark awareness. And also, and this is what we do with our residents, medical students, psychiatry fellows, all the way up, the whole nine of people who do the rotations with us. We also train them on some psychoeducation and some therapeutic techniques. So even if you're not going to be a therapist as a psychiatrist or working with children or adolescents, or adults, you can still learn the way that you engage that enables you to make more of a fundamental human connection and being aware of resources in the community that you can direct them through, whether it's in partnership with your licensed clinical social workers like Monica, or even you're aware of the community and you can make references because, as just mentioned, you're out in the community, you build those type of professional networks that you can refer people to, and they do good work, and a reputation builds and ripples to the point of where you have these resources inside and outside your office can be helpful. And being able to, ecologically move, that's not the domain of just social workers or just psychologists or just community psychologists. That's really something all of us professionals should be able to do. That includes the ones who are primary care physicians. And I guess I'm a little bit biased that I have actually seen that work for multiple decades. And I know it can be done when there's sincerity to the application of the intellect and the emotion to really make that happen.
Appreciate you, Dr. Jalil. For the next question, what avenues do you see available for us individually to promote improved mental health with fellow members of the armed Muslim communities? Additionally, how may we stimulate positive change within the community on an individual scale once we are out of the pandemic-related lockdown? Again, I'll leave it open to anyone who wants to answer. I guess I have to pick on someone. Let's see. Let me go back to Sister Hannah on this one.
Can you repeat that question?
Yeah, sure. So they pretty much want to understand how improved mental health can be promoted within the Muslim community, and in ways they can make sure that positive change is constant and growing on their individual level, especially once all of this is over, like was said earlier, when we no longer have to shut down, we're in our new normal. So how do we continue stimulating positive change for promoting improved mental health within the Muslim community?
So that's actually a great question, and my focus is more on the disabled community. So I would actually pass this off to one of the other panelists.
Who
For
are
mental
very
health.
modest and shy. Thank you, Savannah. But just to clarify,
well,
I can ask. Yeah, go ahead.
I can go. I wanted to give Hannah a chance to answer, but I think anybody could really answer it in the sense that you don't have to be a professional to really work through this question. I really do think that mental health is a process for each individual. You have your own experience that you bring from your family experience to intergenerational issues. If you go on a journey to understand that or a path to try to find a pathway to understand that, I think we begin a discussion of mental health in our own world, with our friends, with our family members. And, you don't have to be a professional to get into that. I think, the more we explore, even when we talked about the issue of white privilege, part of just knowing and recognizing racism or issues in our society is to have the discussion about what's actually occurred in your own upbringing, or also what type of what did your generation before you deal with or experience, and at the same time, current issues that you see around you in your community. So I think that's part of how you work towards improving your own mental health, but also recognizing that, this is an ongoing process, and that community members, everybody has their own story, everybody has their own experience, and to recognize that vulnerability, just to be able to have some vulnerability in your mental health experience, is a first step to having that discussion with anybody or with even yourself. And I don't think that's appreciated enough in society. There's a lot of researchers and writers that talk about it, but we are part of the human experience where vulnerability is inherent in our mental health experience and our life experience. So start with that, and I think moving on from there, you'll see some real progress.
Brother Jalil, I'm going to tap with you since you're working with youth. How do you take that particular approach to inspire and encourage them to be mindful of, their mental health, but also support others who are going through any type of mental health trauma?
I think we have to shatter the silence, and really, and not to pick on us parents because I'm one, but we really can't hide our vulnerabilities. Not saying necessarily expose all our weaknesses, but we have to be able to speak to and normalize vulnerability. And as a Muslim, really, we know that we are created weak, and that's why we turn to Allah to inspire and strengthen and replenish. And with the youth, I guess I would say that we have to be open to the new experiences that our youth are going through that we didn't. And I find that that's a tension point. So it takes energy to learn about what's the most popular music, what's the most popular movies, what's the latest lingo, what is TikTok, and being able to, Facebook is old, and I talk to some people that think, well, I'm on Facebook, I know about the youth. It's like, no, you don't. And what's TikTok? I'm like, okay, right away, I know there's a problem. So, the challenge is that some parents like, well, those are negative influences. I don't want to be involved in them. I don't want to be exposed to them. I go through the same thing. But you can study them without necessarily having to indulge in them or look at them or watch every movie. But you need to at least know what people are going through. And if we make ourselves more accessible as adults working with our youth, it helps. Also, the social support to be able to strengthen our youth to share their voices, share their perspectives. No, it's not always going to come out right. Yeah, they may say some things you're like, well, that's silly for you to say at your age, but they need to say it as part of a growth process that we support. It almost gets back to what Muslim was talking about at a more intensified level. We have to open our ears and open our hearts to give space for our youth to be able to participate. And I've been at some places before where there would be kids who might be disruptive. And some of them were disruptive because they were autistic, that I knew about that maybe everybody didn't know about. And just the change of when you have the imam not say, keep your kid quiet or get out, but hey, that's okay, I'm going to speak up. We want all of our families here and just keep right on going. That's a very supportive statement that kind of breaks the norm and shatters the silence. So there's some folks at different levels of being able to manage themselves, of being able to cope. Even when we're talking about substances, there's some Muslim parents would never ever feel comfortable acknowledging their children have addiction problems because it's a stigma, and it's doubly stigmatized because they'll say, well, what happened to you? Why weren't you a good parent? When actually I work with kids who have substance abuse problems who are Muslim and non-Muslim. And when you keeping it real and you seeing what's going on today, back in the days, there weren't times where people stole as much prescription medication, mixed it up in their own youthful ways, and then found ways of taking it. We just now started having, in this generation, people who play around with ADHD medications to the extent that some kids fake ADHD symptoms to be able to get the Ritalin and the other stimulants so they can do better at school. And these are the elite students, right? There's a whole new wave of challenges which are going on. And if we don't create space for our youth to be able to tell us what's going on in their own language, in their own way, while referencing things that are important to them in today's culture, so we know we're listening and we're receptive, then we'll lose them. Once we get them into space, then we have to encourage them. You take the lead. There's many projects I've been part of where we establish youth advisory boards, youth activists. When youth talk to youth, saying the right thing, it's much more powerful. Sorry, than any of us, because it's coming from a peer group that's also sustainable to be able to make sure that they're in contact with each other and they feel a connection. So, I mean, there's lots of things I think we could do to raise up the voices of our youth. This does not mean not hold them accountable, but it does mean that we can clear a lot more space than we used to enable them to participate, because actually not only participating in social change, they're actually the leaders of social change, as we see with some of the community unrest and protests which is going on now. I think the last thing is we need to make sure they understand also some of our elders' wisdom and some of our professional experiences. So just a quick note, when we were talking about addictions, the healing trajectory of addictions is not linear. Okay, if you know about addiction, you go up, down, there's relapse. That's a normative part of the process. You don't want it to happen, but it happens with a lot more occurrence than people may know. So then you have families who turn their backs on youth after one relapse, even if it's hardcore stuff that they're on, because they'll say, we helped you, what's wrong with you? Well, if you understand the science of addiction and recovery, you know relapse is not the same as relapsing on other things. So you have to kind of brace for that and build for that, right? And then you don't dismiss our youth as just being horrible, incorrigible. You say, we understand what you're going through. We understand these new substances. We understand these new pressures. We understand that we're willing to try to help you. And it kind of creates a different space for us to be able to interact.
Particularly what you just said, Dr. Jalil, that's one of the primary reasons why when at least I have the opportunities to encourage some type of mental health panel, is on that note that we, first of all, don't discuss it just off the bat, but let alone, there's still not even a full understanding of what that entails, right? And the ongoing years of trying to keep on whatever straight path in a sense, right? But very quick to dismiss and even just to cut off all ties with family members or friends from that. So it's very much a serious issue, and hopefully that's something that people will heed to. So thanks to you and Roxana for answering that. But one more question, and the final question actually. So this is, I'm sorry?
So sorry. So Dr. Roxana had to jump off.
Oh, okay, cool.
Engagement, just letting you guys know. I think she's still here if she wants to say goodbye. Thank you again, Dr. Roxana, for joining us today. And we'll keep in touch.
And most definitely. See you, Dr. Roxana. Assalamu alaikum. So final question, fitting. So this actually is from one of my colleagues at CAIR-Chicago, our civil rights director and litigation attorney, Phil Robertson. Hey, Phil. We, as in CAIR, Chicago Civil Rights Department, are occasionally approached by potential clients who appear to have mental health issues. Is there a tactful way that, someone else is jumping on. Is there a tactful way to suggest that they can seek help for themselves? And I guess this will be to Dr. Jalil.
I'd like to defer. I think I've said enough. Dr. Roxana or Sister Hannah, would you all like to address that?
Actually, that
I
one's
am
all
still
you.
on. I just want to let I'm still
okay.
on, but I feel that I kind of said a lot too, so I want to give Hannah a chance.
No, honestly, you guys mental health experts, I'm not speaking over you today. Like, this is your lane. I'm going to let you take it.
I love the spirit, y'all. Yeah. All right, Roxana, before you go, can you address that briefly?
Yeah, I just stepped away, but I understand that the question is about mental health in terms of future issues, or maybe you can repeat it for me.
Yeah, so it's pretty much how we opened up, that we do have a number of community members who become our clients. And I think it's in two categories. So one category would probably be just experiencing whatever trauma, from verbiage to physical, something of the sort, and then how to deal with that. But the other category, which I think Phil is probably attesting to, is you can get the sense by certain ways they act, certain ways they speak, that there is an actual mental or potential mental health issue, or and forgive me if I'm misspeaking on that, but something where they need to actually seek professional help for possible diagnosis or strategies and ways for them to deal and even acknowledge that they may have a particular mental health issue. So how, if in our organization, we don't deal with mental health as a direct service. However, we kind of are on the receiving end to some extent. So in what ways can civil rights advocates are sure to direct, if possible, community members that may present mental health issues?
Well, I think that the challenge is how to, help people who are suffering from trauma issues in the past, and then how to help them with, dealing with it now, I think in the community, and how to kind of move them forward past that. I think that stigma is the largest issue that we're dealing with within the community. And I think, how do we combat that is one of the reasons that we work towards advocacy within the masjid and along, any kind of healthcare setting, is to reduce the impact of shame when people suffer from mental health issues. And I think that's a major barrier in why trauma is not treated, and why it's not spoken about, and why any type of mental health issue that someone's dealing with within the community is so hidden away. We might even hide our own family members. We might never discuss it, knowing that they're suffering. So imagine the disservice we are doing to our community members, but to our own family members who might be suffering. And I think that we have to do as much as we can to reduce the amount of shame around having a mental health issue, but also know that every individual within a family is touched by this, that we really can't kind of continue to live on with the sense that people are going to be, isolated from this and non-impacted. There is trauma usually in every family system, or some form of tragedy. And when you look at that honestly within your own community and in your family system, you start to recognize, well, wait, we're really not immune, even though we want to present to the world a certain idea or image. The idea is that it's hidden away somewhere, and it will come through the generations in some way when it's unaddressed. The idea is to have the conversation so that we can address it, and it won't continue to progress through generations. And I think shame is the major factor here. Our work is to reduce that, and then we can reduce the stigma overall. And I do appreciate Monica's point. I was just letting her know that I do have a little bit of more time, but I'm still here for our ending.
Okay. Well, I appreciate that. Thank you so much. And just to, so I will go to Dr. Jalil again on this one. So maybe to give a more particular example, so that is definitely part of the answer that Dr. Roxana addressed. But say in this scenario, if someone was to come to the CAIR-Chicago office or in some other way, and they present other signs beyond, say, and this might be a slight understatement, temporary distress or anxiety dealing with a certain discrimination or bias or prejudice. Say if someone could be possibly really deep depression or something even greater. And I think the other stigma would be how people would step away from people who act crazy, something's wrong with them. And instead of probably trying to see something more more positive in calming and resolving the situation, people are quick to call the police. And then we know it escalates when, in fact, these individuals may not know they have certain issues, or just as Dr. Rastana said, may not be aware that there are possibilities for them to seek help without feeling the shame and stigma. Any ways in terms of how not only, of course, again, organizations like CAIR, but also people in their families and relationships are able to help with seeing those particular signs. And please forgive the background noise that's somebody driving down the street. Remote.
That's okay. Hey, I work in the neighborhoods where they're booming in the background, so it's all good. There are a couple of quick things I would suggest. One, in terms of professionals and organizations, there should be continued workforce development. And this is one way of sustaining the momentum of addressing these issues. So everyone should probably be trained to recognize certain signs of distress and disruption. This should include when you feel like someone's beginning to have a psychological break, or maybe somewhat detached from reality, whether it's temporarily or you see it as an ongoing issue. What are the ways that you de-escalate? What's non-provocative language to inquire? What's ways of being patient as you manage the situation versus trying to provoke them because they're not responding fast enough or they're caught up in a psychotic episode? You can have any range of issues which may come. Workforce development should train you how to distinguish between an emergency situation that needs immediate, maybe professional crisis intervention versus moderate issues which are difficult, but you're going to work through them, versus minor issues which may be irritants, but with the proper training, it doesn't have to disrupt your day nor cause for an escalation in the situation. I mean, there's a lot underneath there, but workforce development should distinguish which ones, when you're calling 911, because there's an imminent threat of maybe, serious injury or loss of life, versus someone's in your lobby or someone's, at your desk and they're disruptive. And how do you manage both without necessarily bringing in some excessive forces? Does that make sense? I think that there's training that's necessary, and it doesn't mean everybody's got to run out and get their doctorate degrees. It just means you need some signs to be able to index and understand within context, and you need agency support. So you have procedures in place that if situation A, then do one. If situation B, then do two. And it needs to be a sync across the various staff. So for example, I'm someone who's worked a lot with gangs. I've taken martial arts. I used to play football. I'm pretty comfortable with physical confrontations, right? That does not mean that should be the norm for my entire office, because it could be something escalating because I might know martial arts. I feel like I can kind of protect myself and handle the situation, versus someone else might get hurt. We need to come to some agreement on what's office policies in dealing with people and dealing with the public, right? Now, if you talk about my personal life, I think this is where I suggest we're in a good place at beginning to develop resources. You should be able to Google and bookmark psychoeducational, publicly accessible public health materials, which can teach you about what does it mean to be depressed? What does it mean to be anxious? What does it mean when people have like disruptive behavior? What does it mean when someone's psychotic? And there are many, this is not the only one, but there are many organizations which are developing like public education cheat sheets that will tell you I don't have to have a doctorate degree to be able to recognize certain things and know appropriate ways of responding. For example, the Substance Abuse and Mental Health Services Administration is designed to make sure it's very consumer oriented. So you can go to their webpage, you can go to National Child Traumatic Stress Network, you can literally click things that say, this is for parents, this is for the public, this is for youth. And they say the same scientifically substantiated things, but they say it in a language and a style that's tailored toward you as a parent, you as an adolescent who might be struggling. And so we have to get the word out, and everybody should have some set of criteria for how they make those decisions. And if I'm in a group setting, be it an office or a family, I need to have some shared a plan for how I approach the different scenarios which may emerge. And again, it can range from someone just getting on your nerves to someone who's starting to become violent and throw things around, to someone who may come in with a weapon, and you just don't know. Yeah. So I think there are resources out there which are available across the range of presenting issues that everybody should have some training on, both in their professional setting as well as their personal setting. And the other note I'll make very quickly here is that in some of these decisions, when you're setting up as an organization, be it a masjid or a hospital, or a business office, they're not going to be just your decisions. So be aware there's certain policies like at UIC, it's not up to me. And there might be certain policies down at CAIR, it's not up to you as an individual. Like, we have to do this because of compliance or legal issues. So I think it can be done though, especially with the proper consultation from professionals.
Thank you so much, Dr. Jalil. I appreciate your comments. And Dr. Roxana, thank you for joining us. I think this is where we'll wrap up our webinar for this afternoon. On the next page, we will see resources that could be used by you, the public, for further knowledge and assistance. Thank you again for joining me today.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you so much.
Thank you for having me.
Alhamdulillah. Salam.